difficult to control. Difficult to control. Starting and stopping movements is not smooth. So this is what people that have Parkinson's, this is how it feels for them to try to move their body and do simple tasks that we all take for granted. So what is Parkinson's disease? Parkinson's disease is a neurological disorder that mainly affects the dopamine producing neurons. People with Parkinson's disease don't have enough of the chemical dopamine in the brain, and it's also a progressive disorder. Symptoms develop slowly over the years and tend to get worse and worse as they move through the 5 stages of Parkinson's disease. So we're talking about dopamine and how this affects Parkinson's disease. So when dopamine is low, the brain decreases the body's ability to control and coordinate movements. This leaves the person less able to control the body. So people with Parkinson's disease have a lower amount of dopamine in their brain. So when the dopamine is low, the ability to coordinate movements, move their body becomes difficult. So there are 4 major motor symptoms of Parkinson's disease. The number one thing that everyone always associates with Parkinson's is the tremors. Tremors can be mainly at rest, but sometimes while they're moving or walking as well. The tremors can get worse when they're anxious or stressed out. And the tremors can also be debilitating in the fact that it makes it difficult to do simple tasks, feed themselves, things like that. They also have slowness and paucity of the movements. So movements that are not meant to be quick, swift, are often slow, or they can't make it in one swoop motion. It's more of like a step-by-step movement for these movements. Their limbs become stiff and rigid. It's creates difficulty walking, ambulating, getting from a chair sitting position to a standing position, and getting from a standing position to a sitting position. So simple tasks, moving, walking can be difficult. And of course, gait and balance problems. One of the key symptoms or signs is a stooped posture. They do the pill rolling with their fingers. So they have a tendency to potentially fall. And with in the healthcare field, that is one thing we do not want to happen. There's also non-motor symptoms of Parkinson's disease that can also affect these patients: depression, anxiety, apathy, hallucinations, constipation, orthostatic hypotension, and sleep disorders. So as you can see, these make their life difficult. They're not able to sleep if they're depressed, they're hallucinating. Orthostatic hypotension is very serious. It's when someone stands up, their blood pressure drops. So it can be very difficult for somebody that has orthostatic hypotension to ambulate, because as soon as they stand up, their blood pressure drops, and that just increases their chances of falling. So as you can see, with all these symptoms, difficulty moving, difficulty walking, a tremor, all these other symptoms, it makes a lifestyle of somebody that has Parkinson's very difficult. There are 5 stages of Parkinson's disease. The first stage is stage 1. Symptoms are mild, usually on one side of the body. At this time, the doctors may not know that someone has Parkinson's. Stage 2, symptoms begin to affect both sides of the body, and they are more obvious. Stage 3, symptoms are very obvious. The person's balance and walking are affected a lot. Stage 4, symptoms are more severe. The person can still walk, but not very well. Stiffness and slowness are a big problem. Many people at this stage are unable to live alone. In stage 5, symptoms are disabling. The person is unable to stand and walk. They're completely dependent on others and require constant care. Usually at stage 4 and 5, person's loved ones, family members will try to step in and care for them. How is Parkinson's treated? So there's no cure for Parkinson's disease. I've done some research. They can do a deep brain stimulator that delivers a small electric current to the brain. This tries to increase the dopamine in the brain, to try to help the movements. And also there's medicines that help with symptoms. Most common are Cinemet, Elderpearl, and L-Dopa. These drugs, they're described as an on-off switch. So meaning while drugs are in the system, the light switch is on, they're working well. As soon as the meds taper off, it's like a switch off. So it's important to take these meds at the same time every day. How can home care help with those with Parkinson's disease? So as I discussed earlier, Parkinson's disease is a progressive condition, which means there's a progression of care that needs as the disease advances. As I said earlier, sometimes family members try to help care for those that have when the disease has progressed to the point where they're unable to care for themselves. So it's much easier to explore your options and start with agencies before the extensive care is needed. I've found it's nice for for clients when they start care early with us, because as they progress, they become more familiar with the agency, more familiar with their caregivers. They trust their caregivers more. It becomes more like a friendship or a family member with these caregivers and these clients. They become very close. So it's easier to start care before you really need it so that you can become comfortable with your caregivers and trust them. And then knowing about all your available options ahead of time, so when it's time to make the decision, it's easier to start care. So as I said earlier, it's the family members try to take on the caregiving role, care for their family members, their other loved ones. This can also put a strain on themselves. Caregiver strain is real. It impacts the way the family caregiver can provide care. They get overwhelmed at times, so they need a break as well. So that's something that home care can do. Especially if you're starting early, a couple hours a day, couple times a week, allows the family member to go to the store, do an exercise class, do an art class, something that gets them out, allows them to just decompress a little bit of respite. So when is it time to get outside help? Parkinson's disease progresses differently in every person. So for every person, it's going to be a little different as to when and where and when do you start care? What agency works best for you? As the disease advances, your needs might evolve to include a home health aide for a few hours that may increase to a full-time assistance. And as the disease progresses, people may need extensive help with activities of daily living that may require outside help. So if you made a decision to start home care can create plans of care that are individualized. So I know that with BrightStar Care, we will make visits to the home. We'll do a home assessment, assess what equipment you have, assess the home itself, make suggestions like pulling up area rugs, moving items out of the way to make the path clear. Also discuss what the client wants the caregiver to do for them. And then also, like I said, it provides respite for family members to reduce strain. Home care offers dynamic services, so we can provide companion care. This includes sitting with a client, driving to appointments, some housekeeping, taking them to lunch, taking them out to a park, getting them out of the home. We can also provide personal care services, so assisting with activities of daily living, bathing, dressing, laundry, housekeeping, things like that. We can also still take them to appointments, sit with them, take them out to lunch, get them out of the home. And then we also provide skilled nursing. So filling a medication box. As I was saying earlier with those medications, it's so important to make sure they're taken at the same time every day. So make sure the pill box is filled out correctly so that there's no skipped medications, skipped doses. We can also provide wound care and medication administration, many other things. So as the care progresses, we can also progress the services to fit your needs. This is a screenshot of a plan of care that we would fill out. So it goes over, are we getting vital signs? Any hygiene? So are we showering, doing a bed bath, chair bath? Are we doing mouth care, brushing teeth, brushing dentures, shaving, skincare, getting dressed, getting undressed, helping with going to the bathroom, changing the linens on the bed, making the bed, laundry, light cleaning around the home, assisting with using walkers, transferring to a chair, to the bed, ambulating, mobility, preparing meals, giving the clients protein shakes, feeding them, encouraging fluids, and assisting with medications. So we would sit down with the client and create this plan of care. This is a template. This is not everything we can do, and we tailor it to the client's needs. Does anybody have any questions?
Okay, well, thank you, Rachel. At this time, because I pushed record after the fact that I was introducing Rachael, I'll just reintroduce her again. So Rachael is the Director of Nursing for BrightStar Care, and she primarily is in Venice and Charlotte, has a lot of experience in hospital settings, and especially with people with chronic conditions like Parkinson's disease. So thank you, Rachael. You have given so much information, some really good points. This is a great opportunity for people to put questions in the Q&A bubble, and I am going to read those. Let me just change the view here and make sure everybody can see us. And you can stop sharing your screen, okay, Rachael, and then we will all be present. There we go. And let's just change to gallery. Okay, now everybody can see everybody. All right, let's see if we have any questions. One thing I wanted to bring up too is because I pushed record, we're Neuro Challenge. We are a nonprofit organization here in the Southwest region of Florida. We serve 6 counties, but since the pandemic, we really have served really the world and the nation with all kinds of educational and supportive programs. So just wanted to let you know that's who we are over here, and happy to have BrightStar with us. All right, so somebody has a question, and this might go to Doris. It is, what is the cost? So good question. What is the cost for some home healthcare services?
Yes, can you hear me?
Yes.
Okay, sure. So it really depends. We can provide care from 1 hour up to 24/7, and we can do that, implement that very quickly. So the less hours you have, it's going to be a little more expensive because it's difficult for us to, again, rely on a carrier just to do a lot of driving just for 1 hour. So it can probably go from, let's say, $50 per hour down to like $33 or $36 per hour when you have 4 hours or more. So it really depends. So I go by different brackets. So you have 1 hour, it's going to be one pricing. If it's 2 hours, it's going to be a little bit less, it's still expensive. I typically suggest to people that they do 3 hours or more. That's kind of your best scenario in terms of the money and getting more done in the home. And 3 hours go very quickly. Not only the person, the caregiver can come and help you with, any like bathing needs or getting dressed. You have to go to a doctor's appointments. They can drive you. They can do a little bit of housekeeping, cleaning, again, anything in the home, meal prep. So, but yeah, the best scenario is like 4 hours or more.
Okay, thank you. And you know what? It's really nice to know that BrightStar also has three levels of care, maybe more that I didn't
Yes.
see, but the availability for just somebody to be a companion, just to come in and just sit with, not necessarily doing hands-on care. And I think this is very important for us to remember in the Parkinson's world, because there are many times when the care partner, the caregiver, whether that's your spouse, family member, or just a friend, they can go through burnout rather quickly when dealing with someone with a chronic illness. So it's important that the caregiver, the care partner, does get some respite now and then, right? Just a little bit of a break, and a few hours a week, a few hours a day, however that looks, can go a long way for longevity of care. So I think that's really important. Any other questions out there? You can just put them right in the question box for us and we will read them. Give people a chance to put some questions in. But another good thing that Rachael brought up was the importance of making sure your medication is given in a timely manner. So you want to, not be too early with your meds, not be too late with your meds, not double up on your meds. And sometimes it is important to receive home health care to help you do this, whether they line up your medications or they actually administer your medications. As you progress in your disease, it gets harder and harder to do that properly. So it's a really good idea to look for home health care to help you with that. Rachael, Doris, anybody you want to say anything about that, about the medication pieces, or?
Yes, actually, yeah, make reminders. So that's a big part of, again, clients, patients with Parkinson's disease. So that is a kind of a major point, and that is something that the definitely the caregiver can come and help out again with this medication. Point out, remind them, and making sure again that medication is taken on time. I don't know if you want to add something, Rachael.
As I said earlier, my grandpa had Parkinson's, so I could definitely tell a difference when he forgot to take his medication. So I was constantly calling him, making sure he filled his or took his meds, trying to fill his box. So it is important. It's definitely like that on-off switch. Most drugs don't act in that manner, but those do.
Right, good point. We do have another question. I'll read it. Does long-term care insurance pay for home care?
It
Yes.
does. So yeah, typically we're private pay, or if you have a long-term care insurance, such as like Genworth, John Hancock, you have, many other Bankers Life. So we do have actually many clients with those types of insurance. And depending on the insurance, they can actually cover many hours per week. So typically we, tell the client just to contact the insurance to understand the requirements, because they do have very often, several requirements, and understand exactly they will pay right away. Sometimes they have what's called an elimination period. So it's like a deductible. So you have to pay out of pocket for, X amount of days, like 90 days, 100 days. Sometimes it can be right away. That's kind of the best scenario, but definitely, yeah. And we actually file the claims on a client's behalf, so we can definitely help with that. One of our owners was actually in a, long-term care insurance like for 25 years. So he's really hands-on, very, knows a lot about it, and definitely can help with any of the insurances, getting those things again, kind of started. We also are listed with a VA. So if any of you actually, are VA recipients, that is something that we can help with, because again, we take care of many veterans. So those two are probably the two ways that, again, you can help a little bit with, again, payments.
Great. Yeah, I was going to ask about the VA, so I'm glad you brought that up, Doris. That's a good point. We do have a lot of veterans, especially with Parkinson's disease, and to know they can use their services this way is great, or their benefits, excuse me. We have another question. This person says, where is BrightStar located and what areas of the country do they provide services?
So BrightStar is a franchise.
Yeah, go ahead.
Our owners, Lisa Marie and Jim, own the Venice and Port Charlotte location. So our territory goes from South Sarasota, thinking about Clark Road, down to Punta Gorda, out to Boca Grande, and then out to Arcadia. But BrightStar, like I said, is a franchise. We have neighboring facilities and to the north of us in northwest Sarasota, Fort Myers. They're all over the country, and I think in every state. So they're all over the place.
Mm-hmm. Good, thanks for answering that. Yeah, and another thing that I always think about is, you know, when you're thinking about getting care in the home, it's so important to remember that this is the least restrictive environment for somebody, is in their home. And allowing somebody to stay in their home longer by providing home care services is such a powerful thing to do for somebody who has Parkinson's disease or whatever condition they have, because it does allow them that privacy of being in their own home and not having to move into a facility as quickly. Not everybody can afford it, but it's certainly a good option, and it's a great place to start. Great place to start getting that care, getting organized, getting respite, having breaks. So I think home care is a great thing. Does anybody else have questions out there, or would you guys like to say any more?
My presentation was just geared more towards home care in general, but as BrightStar Care, we have nurse oversight. So if there's anything going on while you have care, we can always send a nurse out for reassessments. The nurse actually develops a plan of care, so you have more specialized person creating that plan of care, understands the disease process, understands the needs that you're gonna need. So that's a good thing about BrightStar is we always have nursing on call and nursing available.
Yeah, and that is a major difference between us and some of the other agencies. We're just one, I think, out of two companies in all of Venice, again, to be joint commission certified. We're the only company actually that is joint commission in Charlotte County. And for those of you who don't know what that is, it's like a healthcare certification that actually holds us to a higher standard of care. So basically, we go through additional requirements to be certified, and all the people who work with us are healthcare professionals, and all of them are certified and trained. And as Rachel said, so basically, we provide nurse oversight. So in case that something were to happen or just to change with any client's condition, they can always call us or access, one of our nurses who's always kind of on call 24/7. So it's always good to have that support again from a nurse, advice from a nurse. That again, some companies don't have that because again, they don't have a nursing staff.
Wow, that's a very good point. Yeah, I understand that. That's great. Okay, I don't see any other questions down there in the bubble, but if anybody has more questions for us after this, you think of something later, don't hesitate to reach out to Neuro Challenge. We have care advisors on staff who can help answer any of your Parkinson's questions. And if you have home health care questions or you want to find a home health care agency near you, we help do that. We actually deliver resources like that to our clients every day. And BrightStar is one of the agencies that we do refer to. So please reach out to Neuro Challenge if you need any support with Parkinson's disease. And I want to thank Rachel and Doris for being here today, sharing your business with us, letting us know what home health care looks like in the home, especially for people with Parkinson's. So everybody have a great day out there and be safe with this hurricane approaching. Please let us know if you need any other assistance. Okay, take care.
Thank you so much, April. Thank you. Bye.
Bye-bye.